2 minutes or 5 minutes? Way back, I think, Ravi, in 1983, when we wanted to join radiology, there was just plain X-rays. No AI, no ultrasound, no CT, no MRI, no digital images. Why did I take up radiology? Intervention radiology. So I wanted to be a clinical radiologist. So I took up radiology so that I can treat patients. AI has come just recently. I'll tell you an example exactly 35 months back. Exactly 35 months back. There were 59 COVID positive patients in the city of Mumbai. 9 deaths. And no radiologist to report chest X-ray. Can you imagine that? We resorted to AI. And AI helped us in segregating patients in the casualty from a suspect to a non-suspect. RT-PCR was not there because RT-PCR kits were not available. So AI has helped the city of Mumbai segregate patients, high-risk patients, non-COVID patients, COVID-likely patients. And that was the time we could actually control the spread of infection in the city of Mumbai. This was not done in the major medical colleges, but this was done in the slums of Dharavi. We took digital portable X-ray chairs to the houses of people where the cluster of COVID-19 patients. And we could detect 30% more COVID-19 patients purely with AI. Purely with AI. I'm not saying AI is going to replace radiologists. But when radiologists are not there, I think AI is going to simplify things. It's 35 months now. And that was 31st March 2020. Radiologists will always follow the long tail of a diagnosis. You will hear this sentence in RSA journals everywhere. AI cannot actually have empathy, have patience, have creativity, and diagnose things. I'll give you an example yesterday. I'll take one. I had a patient with uterine fibroids. I'm not a diagnostic radiologist. So the patient comes to me for uterine fibroid embolization. A top-notch radiologist from Thane. Perfect report, ultrasound, but no mention of vascularity of the fibroid. So I refer one more colleague of mine for an MRI pelvis to see whether there are blood vessels within the fibroid or no, because not all fibroids are going to be hypervascular. Agree? Imagine. So unless I know that there are blood vessels in the fibroid, there is no point in embolizing. The MRI report also came the same thing. So two radiologists not wanting to tell us whether the fibroid is hypervascular or avascular or hypovascular. What is the need for me sending the patient to an MRI specialist when I don't get an answer? It's the same description in both the reports. So a radiologist has to be more intelligent, not artificially intelligent. So that's a very big difference between intelligence and artificial intelligence. Artificial intelligence is never going to conquer intelligence, human intelligence. So our workload is going to improve. My workload 30-40 years back was just few angiograms. Just because AI came, CT came, ultrasound came, MR came, interventional radiology also came, and now we are coined as interventional radiologists. But a time will come that we will not be called as radiologists at all. Because I was talking to Hemangini about 15-20 years back. What is ultrasound? I said, no, there is no modality by the name of ultrasound. It's either body imaging or nothing else. Ultrasound is just a means to segregate patients one from the other. That's not only one investigation which is going to diagnose everything. So anything digital, you will definitely have more grayscale, more pixels to be diagnosed, and that is what is artificial intelligence doing right now. IIT Delhi is having a gloves being manufactured or probably developed. Once you wear those gloves, your ultrasound probe will scan the patient. You just tell the ultrasound probe, scan the pelvis, scan the abdomen. You automatically, your hand and the probe will rotate around the abdomen. This is being developed right now in IIT Delhi, where I am a student right now. So things are not far. I think we should accept artificial intelligence, add it to our armamentarium of practice, adopt it. I think we should get, that radiologist term, I don't like that radiologist term. We should coin something new now. Radiologist is not just radiology. You are one of the physicians who are going to see patients and treat patients. And with artificial intelligence, with radiologists. Thank you.
So suddenly I find at KEM Hospital that AI generated reports are being made around the same time that you have. And I said, what nonsense, how can we do this without consent of the patient? And the CEO said, this has come from the government of Maharashtra. So the same software that Dr. Deshmukh is talking about was doing this in the background. And I'll tell you what it did. It diagnosed COVID in patients with congenital heart disease and pneumonia when there was no COVID at all. And I was so angry that I ran it through dorsal spine x-rays, I ran it through thigh x-rays, and it did whatever it wanted. It said COVID in dorsal spine, no COVID in thigh. It could not recognize that the x-ray was not a chest x-ray. And then I wrote a very bad report and I got a phone call from the secretary of Deshpande somebody, and he said that we want to do it in Dharavi, can I do it? I said this is a complete disaster, stop it. It cannot do it. When human beings don't know about COVID, what is AI trying to do? We are just learning from COVID. I don't know what happened, but I'm not saying I'm one way or the other. I'm just saying what happened to that software. I showed it to us. Look at this. It is writing COVID on thigh Excel. What do you want?
we never labeled X-ray chest as COVID-19. Mind you, we just segregated them into highly suspected COVID-19 and non-suspected COVID. We never instituted anti-COVID-19 treatment for these patients. So there was always a radiologist, and definitely during March 2020 and April 2020, the AI was getting a lot of data from all these X-rays. And we never wanted to diagnose COVID-19 in pediatric population or any other X-rays. It was just frontal X-rays, nothing else.
Actually sandwiched between two eggs. KEM, HOD, so I'm going to move out from here. That was what you had promised. Wow. Okay, so it was a nice debate. But I just wish there was a little more punch to it. Like I said, a debate is not necessarily about the truth. The debate is about winning. I still remember Dr. Krishna is a nuclear medicine person in Lilavati Hospital now. He was in Hinduja earlier. And we had a debate where it was about CT pulmonary angiogram is better than VQ scanning for pulmonary thromboembolism. It's a no-brainer. I was for the proposition. He was a nuclear medicine person for the opposition. I went in saying, what's the big deal? This is it. You can see it. Even my tech can diagnose pulmonary embolism at 2 a.m. in the morning. How can nuclear medicine be better? At the end of the debate, he convinced the House that nuclear medicine is better than CTPA. for pulmonary embolism simply by the way he spoke. He hit below the belt, he did everything possible. But when there was a show of hands, everybody said, we believe EQ scanning is better. And that is what I wish there was a little more punch to the entire thing. What the opposition kept doing is what our politicians keep doing everywhere. You started with the foreign hand. We will blame China. What was it? The data companies are from the US, China, they will steal our data. So every time something wrong happens in India, please don't record, na, they'll arrest me and something.
I will edit it.
So, what do we do? Our politicians will not accept the fact that we have an Indian problem. It's the China hand, it's the Pakistani hand, it's the Bangladeshi hand. It's not that. You can't keep, doing that. And then you're playing the cow hand also. In the end, in India, whatever happens, you go to Gaumutra and Gau something. So you're like cows on the road. How will there be autopilot cars if there are dogs on the road and then cows on the road? So it was simply that. And then you're played, and then that one thing where you're really hit below the belt, which is telling them that, if they are for the proposition, they should pack up their bags and leave. That's the debate. They were supposed to say that you can't ask them to do that. I wish you all had spoken about some really actual commercial applications that have replaced radiologists. Just talking about chest x-rays, talking about bone age, those are fine. But that an acute stroke today, when a CT perfusion is done, the images go straight to the neurologist and the interventional neuroradiologist, bypassing the diagnostic radiologist. And the software tells them whether a thrombectomy has to be done or not, and patients are treated based on that. To talk about whether patient permission is required, whether they will accept the diagnosis or not, I think it's very disingenuous when a patient doesn't even know who a radiologist is and what the role of the radiologist is. If the neurologist says, I've seen the MRI or I've seen this and this is what it says, the patient cares a shit about whether there is a radiologist from the background who's given that diagnosis to the neurologist or the neurosurgeon or not. So to talk about we require radiologists, patients require radiologists and patients will ask who has diagnosed, that doesn't make sense. Yes, we are important, but let me come to that in a minute. The only person who stuck to time was Drumel. So you who's Drumel? Yeah, 5 on 5. Everybody else overshot either on their timing. Aparna, you stuck to time, but then you overshot on the rebuttal. So that was that. The other person, right, so when it came to speaking, has any one of you done debates in school or junior college, etc.? None of you have. So, and your, so that we got here. And I think that was the rest of the marking I will talk about a little later. If you define medicine, what is the definition of medicine? The practice of medicine is a judgment call based on the current scientific evidence and what you understand of data and science. But in the end, it's a judgment call. Radiology is, in a way, two things. Right? One is we look at images and we recognize patterns and we make a diagnosis, so we write down findings. Then we put all of that together to come to a diagnosis, and then we make a judgment call on the possible etiology. It's like if you see an opacity in the lung, you might think that it's consolidation because there are air bronchograms. And then you might even be able to make out whether it's post-obstructive or non-post-obstructive. But in the end, the etiology of that consolidation, whether it's pneumonia, whether it's invasive mucinous adenocarcinoma, whether it's a lipoid pneumonia, all depends upon the clinical story. And that is where the radiologist makes a difference along with the chest physician or the physician, wherein you collate everything together and then make a judgment call of what is to be done. So, will radiologists be replaced? Of course they will be. Who wants to read chest x-rays? I mean, seriously, they are. I mean, when there was nothing else, it was great, reading x-rays and trying to make out shadows. Let AI read all the chest x-rays. It doesn't make any difference. Bone age, the worst thing that a radiologist would want to do is to read bone age. I mean, it's not our job to do bone age, for Christ's sake. AI wants to do bone age, it's perfectly alright. Right? Look for rib fractures. I wasn't born to pick up rib fractures. I mean, if the AI can pick up rib fractures better than me, fantastic. I have no problems with that. But will the AI look at a CT chest or a CT abdomen in a non-acute setting and tell me what the diagnosis is? It will put together the findings, but it is for us to then turn around and put all of that together. Where we will be replaced is in all the acute care settings, right? In acute care, we don't do well. In India, we don't even arrive to look at the scans. Resource poor, so that perhaps aren't even radiologists, but most of the times we don't even come and try and look at the scans, and we hope that the technicians and the neurologists will figure out whether there's a subdural or an extradural so that we can sleep a little extra in our rooms, etc. AI will take that over, obviously, because the neurologist will ask the tech and the AI, is there a subdural or not? If they can't make up, and they'll figure it out and we'll be out of the loop. Acute appendicitis, cholecystitis, pulmonary thromboembolism, acute stroke, none of that will require a radiologist within the next 5 to 10 years. When you talk of AI having a longer implementation in India, in fact it's the other way around. In a resource poor setting, AI is a far better tool for people like us than it is in resource-rich countries, because there you have people who are reading. One of the problems we've always seen is, and Dr. Mahesh Kulkarni is here from Australia. Thanks, Mahesh, for coming. You should ask Mahesh, how many scans do they read in a day? Inclusive of, let's say, if you're doing 50 x-rays and then ultrasounds are done by techs, or 20 ultrasounds and CTs and MRs, it's anywhere between 100 to 150 scans a day, which would include about 50-60 actual CT MRI scans. In India, you ask any radiologist to read more than 15 scans, CTs and MRs put together. मेरा तो पूरा दिन गया, अभी तो मेरा सर ये पक गया है, मेरे से ज़्यादा होता नहीं है. In the US, every radiologist in their session of 8 hours with a lunch break in between will read 75 to 100 scans, including talking to physicians, including doing the dictation and correcting, including complicated cases with comparison. We don't do that. This is not resource poor. We are used to doing only 15 to 20 scans ka report every day, and then we are, bad day today, I did 25 scans today. So anyway, so the point is, if that is who we are, AI will replace radiologists in India before they will replace radiologists in resource-rich countries. And I think some of that could have come out here, and maybe real-life examples of how Dept, for example, in Pune is using AI in all their teleradiology setup, about what they did in Tamil Nadu, where they do TB screening, and they have about 600 X-rays every day to be read, and AI is doing the entire thing because it's humanly impossible for radiologists to do it. And because now they have AI, they're ramping up by going from 600 to 1000 to 2000 people every day being screened. So those examples would make sense, not the Boeing example. I mean, I don't think that works very well in this setting. It's talking of pilotless cars or, all of these AI corrections outside of healthcare does not necessarily translate into healthcare. What you could have spoken about is, for example, the mistakes that ChatGPT makes right now. About the fact that you can, if you use DALI or Midjourney, how you can fool them into creating a CT scan image that you would like them to do. So if I tell them, please create a CT scan image of a 56-year-old man with a right adrenal adenoma, DALI will create it. And if DALI can create that, it's a fake image. Right? So those are the things that you can come up with to say that AI is not truth because you don't know what you're seeing is actually what the AI is telling you about. So that's pretty much where we are. How many of you have seen the Terminator set of movies? Terminator, not bad. So you know that the biggest fear we have is of Skynet coming to rule us and eventually decimating the population. If that happens, is that a future that we are looking at? I have no idea. I am not an expert on general AI. I do not know if that scenario is possible or not. But the pace at which things are moving, I do not know. If the entire population can be replaced, who are we radiologists? We are just part of a small segment of medicine that can completely go on. The last bit is how many Star Trek fans here, how many Trekkies? But if you ever watch Star Trek, you've seen something called a tricorder. So if anybody falls sick, they go to the sick bay and a doctor takes the tricorder and just scans the body, and the tricorder tells the doctor what the findings are. So obviously there's no radiologist, there's no subspecialist anymore, because the tricorder also tells the physician how to operate. They have all the tools, so they will do everything from renal transplants to bionics to everything done by a single doctor and the team. Because at the end of the day, as somebody said here, if a radiologist can be replaced, a physician can be replaced as well. Think about this scenario, right? Let's say that there's an X-ray taken, or the tricorder takes the X-ray. The data doesn't generate an image. It goes straight to the computer that says that there is a fracture of the distal tibia. Any physician looks at it, then the AI says this is how you treat a distal tibia non-compound fracture. You've got your training as a general physician on how to put casts. If you do not know how to put nails, it will tell you also. Put the patient here, this is the anesthesia to be given for this patient with this height, this weight, this is the drug, we will control it. Here is the nail, take this nail, hammer it in, put it through, here is the image, everything's done. If a single doctor can do that, forget radiologists, every subspecialty doctor is out, right? So I think those are some of the things you could have brought in as well, made it a little funnier and things like that. But overall, very enjoyable. Thank you so much for a lovely evening. And we'll just do a show of hands. I'm not going to say who won or lost or anything. How many of you truly believe that AI will replace radiologists? Okay, how many of you believe that AI will not replace radiologists? Okay. So will not is still in the majority. We should repeat the debate after 5 years and then see what has changed. I had a great time. Thank you so much.
So I'd like to call upon Ravi sir to say some words.
Am I audible at the back? Okay, fine. As Bhavin said, this was just fun. My idea of all this is to take you away from the routine grind of reporting and think differently. I told you, you have to have, if you are a human being doctor, you have to go beyond imaging, which is what AI cannot do perhaps. So you broaden your scope, you think, you read more. Many of you have read lots of stuff about AI from there, you may read more, so on and so forth. So we have to think of, I don't have to think of all of these things. Now, you people, but you have to think of something new, different, take Dr. Hemangini's permission, and we can have fun and learn at the same time. We have to change the paradigm of how we learn medicine. We don't have to follow anybody. There need not be another department that does it or does not do it. So think of fun things to do. You can say we go for a picnic with her. Why not? I mean, it's a simple example I'm giving you. But education has to be fun. They've been shown again and again that when it is fun, you learn more. So this evening is, I suppose, just the beginning. And whether I give ideas or not, you start the ball rolling, take a permission, do what you want. Yeah? Thank you. Thank you everyone for coming.
I have a question. I mean, I don't understand this, but this thing that when I told Harshita when she started, is this a new thing of when first years calling second years sir and madam and using doctor before their name? I mean,
we have told them 1,000 times not to do this.
but how has it started? Because when we were
They
students,
call their 1 year senior also sir and madam.
how and where did it start?
I have talked about it to many people. It started when people from outside Bombay coming into Bombay and they expected to be called sir. It's simple. The migration started, the mindset started. And once it started, but you love and follow, you call them donkey, they say, donkey, one donkey. So you have to stop. This is nonsense. Absolute nonsense. That you cannot call me by my first name is tradition, you call me, I don't mind. But it probably never enough because I don't call my teachers by their first name, even though they say, call me Sunil, call me this, call me, I don't know it. It's there in a stupid brains. But calling your first year senior sir is disgraceful.
It is.
It is completely disgraceful. You put a doctor in front of your name or don't, it's another big call, it's a big story. Bhavin has a lecture, he can have a lecture again. Here in the MLT, and maybe I'll talk to somebody here about the hubris of being a medical doctor, something like that. No? It's very difficult to say that I'm Ravi Ramakantan. I do it all the time. It's my thing, I told you in lectures also, don't say I'm so a doctor, but that's a different ballgame. But calling first year, if somebody is 3 days older than you, what is called sir, junior sir?
Yes. So let me ask you a question.
Each other, if they are calling him
Correct.
sir, he is not offended.
Correct. So I have a quick question here. Supposing you went to a non-medical party, right? Let's say with other, you got invited by your sister who's an architect, and you went to a party that was full of, commerce people and lawyers and all of that. And you're introducing yourself because you don't know anybody there, right? Will you say, hey, hi, I'm Satyan, or I'm Drumel, or will you say, hi, I'm Dr. Drumel, or I'm Dr. Satyan? How many of you will put a doctor before your name, just truthfully, today if you were invited to a party? Everybody, right? I mean, that's why you're not putting your hands up. Yeah, it changes the equation completely, right? Why would you want to be known as a doctor in a non-medical situation, right? Which means if you're buying an airline ticket, do you say you're a doctor? When you put in a train ticket, do you say you're a doctor? In the passport as well. That is fine. If you want an advantage somewhere, then you use it, right? Because you'll say, "Me doctor, you're hoping they'll take you in faster and you don't have to stand in line. You take advantage if required. You want a 10% discount in the restaurant across the road, you say, I'm a doctor, that's also fine. I mean, why not? But otherwise, always think about this. You've changed the relationship by saying you're doctor so and so. You've made somebody see you differently, and you're no longer on equal footing, right? And the next step is what? That the other person will say, "Hi, I'm Advocate Sunil." The next person will say, "Hi, I'm CA Veena." How does that help anybody, right? So you need to get into that habit of using only your name. And all this sir, and I mean, okay, somebody is 10 years, 15 years older, you, out of respect you do that, but this is not respect. If you say sir to somebody who's a year older, it doesn't make sense.
We take feedback from a lot of doctors and hospitals. After looking at we get feedback. And feedback is your thing. 99% of people who give feedback is that doctors or which
That's another thing. Maybe we should have a debate on this. It's a larger debate. And we've had it. It's a large.
I wanted to tell you, Bhavin, that because we were missing all the punchlines and the fun, I was going to point out there are less number of female radiologists participating. If you see them, more people will be more fun.
I wanted to say that as well. That this is not acceptable. You can't have one woman and 3 guys. Unless you have this unbalanced department. I don't know if that is true. But if your department is 50-50, then the participation should be 50-50. Who's the chief president?
There are more females.
Then why are there no more females or women? Women. Sorry, not girls, and girls is also derogatory. It's women or men. Or I don't know. How many of you use pronouns or say no? You all have not started that. No?
Non-binary.
And any of so I mean, do you all start saying that I would like to be addressed as they, or, and I'm not being derogatory, I'm just saying this is what happens in many places now. Luckily not in medicine, but 10 years from now maybe that will also happen. It's all it's all part of medicine and radiology. Anyway, thank you so much. Had a great time.
Thank you everyone. We have arrangements for refreshments outside the auditorium, and I'd like to call upon Dr. Himangini to give the vote of thanks.
Arranged it. This is really hats off to Himangini for doing this, and thank you.
Thank you all of you so much, and thank you Ravi sir, Bhavin. It's really nice, and whenever we think of such debate and all, we always think of Bhavin as our moderator or the person.
No, I can say sir, Bhavin sir.
Imagine she's 10 years younger and she still doesn't say so.
Yeah, I will say Ravi sir or Dept sir, but not the Bhavin sir. So thank you all of you. Thank you so much.